Hello everyone, welcome to my medical coding tutorial series. In this playlist, we are diving into the CPT guidelines for the integumentary system. I have divided this tutorial into easily understandable parts. For each section, I will go through CPT guidelines with relevant examples. Also, each section will contain MCQs, that is, mimicking the real AAPC CPC exam questions. With the theory and the practice questions, you will easily understand the CPT coding guidelines and how to handle the CPT coding question. Integumentary System Part 3, Benign and Malignant Excision. Excision of benign lesions. The procedure and included services. Excision is defined as the full thickness, that is through the dermis, removal of a lesion including margins. The CPT codes for excision of a benign lesion include simple, non-layered closure and local anesthesia. Codes should be reported separately for each benign lesion excised. So how to select the correct code? The code selection is determined by the measuring the excised diameter. Excised diameter is calculated before the excision by measuring the greatest clinical diameter of the lesion plus the most narrow margin required. So you can see this is the lesion, but the margin is up to here. So you have to include the margin also. The measurement is used regardless of whether the surgical defect is repaired with a linear closure or a more complex reconstruction, example skin graft. So reporting additional closure. The primary excision code only includes the simple closure. If the defect requires an intermediate or the complex closure, the repair must be reported separately in addition to the approximate excision code. For reconstructive closure, for example skin grafts, you have to include the graft codes. Some important exclusions and related procedures. Do not report the excision codes if the excision is performed in conjunction with adjacent tissue transfer. In that case, only report the adjacent tissue transfer code. Similarly, for shave removal, you have to use the shave removal codes. For destruction, such as laser, electrosurgery, cryosurgery of benign lesions, you have to use the relevant codes. For destruction of pre-malignant lesions, you have to see the 17,000 code series. So the excision code series are arranged like this. So it starts with 11,400 to 11,406 is including the trunk, arms, legs, depending on the size, you have to code the procedure. Similarly, 11,420 to 426 include the scalp, neck, hands, feet, genitalia. 440 to 446 include the face, ears, eyelids, nose, and lips. And recently added codes are 450 to 471 that includes skin and subcutaneous tissue like hidradenitis, perianal, perineal, or umbilical regions. So let's see some examples. This is the continuation of previous parts. Question number 15. A 45-year-old male presents with the benign lipoma on his back, that is trunk. The physician excises the lesion. The lesion size, including the required margin for closure, is documented as 1.8 cm. Which CPT code is reported? So there are 4 codes available. Take your CPT code book and find the answer. So here you have to highlight this is benign lipoma on his back. Excised the lesion, diameter is 1.8 cm. So you can find the answer by several methods. In the exam, you can use the elimination method because you can see the answers are nearby codes. So you can use the elimination method. But for the learning purpose, I am using the table of contents and the alphabetic index method. So table of contents method, you have to go to the integumentary system table of contents. There you can see the subheading of excision benign lesion. You can see the code series, or else you can use the CPT alphabetic index where first you have to search the main term excision, then the subterm skin. There you have to go to the benign. So it will lead you the following code series. Again, you have to come back to the tabular list and confirm the answer. So once you come to the tabular list, 11,400 is excision benign lesion including margins except skin tag unless listed elsewhere, trunk, arms, or legs. So in our case, it is trunk, that is the back means trunk. So trunk excised diameter 0.5 cm, but in our case it is 1.8 cm. So you have to read the other codes, that is the continuation add-on codes. Excised diameter 0.6 to 1 cm, 1.1 to 2 cm. So 1.8 is including in 1.1 to 2 cm. So the correct answer will be 11,402. Question number 16. A benign lesion, example papilloma, is excised from the skin of the external male genitalia. The excised diameter measures 2.8 cm. What is the correct CPT code? Again, take your CPT code book and find the answer. So here you have to highlight this is a benign lesion. The anatomical site is external male genitalia. The size is 2.8 centimeter. So again, you can use the table of contents, or else you can use the alphabetic index. Once you go to the table of codes, you can see 11,402, that is excision, benign lesion including margins except skin tag, scalp, neck, hands, feet, genitalia. So in our case, this is male genitalia, and the size is 0.5 centimeter or less. Our case 2.8 centimeter. So second one is 1 centimeter. This one is 1.1 to 2. So 11,423 is 2.1 to 3 centimeters. So that is included in our code series. So the correct answer is B, 11,423. Let's see some complex question. Question number 17. A surgeon excises a 3.5 centimeter diameter recurrent benign lipoma from the patient's forehead. The procedure was complicated by dense subcutaneous scarring and fibrosis from the previous attempt at removal 1 year prior. The surgeon's effort to identify clean margins and perform sharp dissection was substantially increased more time to the typical procedure time. The lesion was removed and a simple closure performed. Which CPT code should be reported? So there are 4 answers available. Take your CPT code book and find the answer. So here you have to highlight the lesion size is 3.5 centimeter, that is benign lipoma, and it is on the forehead. Also, the description says the substantially increased more time. So the time spent by the surgeon is more. So you have to add the modifier for that also. So again, go to the table of contents, go to excision, benign lesion, see the code series. So here the lesion remove from the face. So go to the code series of 11,440, that is excision, other benign lesion including margins except skin tags, face, ear, eyelids, nose, lips. So face included here. So this code is for 0.5 centimeter. In our case, that is 3.5 centimeter. So 3.1 to 4 includes the 3.5 centimeter. So the correct code will be 11,444, but you have to include the modifier 22. The modifier 22 is for increased procedure service. Question number 18. A surgeon excises chronic hidradenitis on the both right and left perineal area during the same operative session. The procedure on each side involved a full excision of the affected skin and subcutaneous tissue, followed by a simple layered closure. Which CPT code and modifier combination should be reported? So there are 4 answers available. Take your CPT code book and find the answer. So here you have to highlight this is chronic hidradenitis, both the right and left perineal area, and the closure is simple layered closure. So when you look at the answers are adjacent answers, so you can use the elimination method for the exam, but in the learning purpose, let's use the table of contents or the alphabetic index method. So if you're using the alphabetic index, we have to go to the term excision, then go to the subterms sweat glands, because hidradenitis is the inflammation of the sweat glands. So sweat glands, there you can see this is the perineal area. So sorry, this is the perianal area. So the perianal region, the codes are 11,470 and 471. Go back to the tabular list and confirm the answer. Once you go to the tabular list, you can see the 11,470 is excision of skin and subcutaneous tissue for hidradenitis, perianal, perineal or umbilical, with simple or intermediate repair. But in our case, it's a simple layered closure. So this procedure is simple. It is not mentioned as a complex one, so we have to take it as a simple one. So the correct code will be 11,470. And this procedure is done bilaterally. So the bilateral, you have to add the bilateral modifier 50. You can see in the code description as well, it says for bilateral procedure, add modifier 50. Let's come to the second part of the video, that is excision of malignant lesions, the code series of 11,600 to 646. As for the benign lesion, the excision means full thickness removal of malignant skin lesion, example basal cell carcinoma, squamous cell carcinoma or melanoma, including margins and simple closure. It also includes the local anesthesia. For destruction, that is not excision of malignant lesion, you have to use the other code series. To choose the CPT code based on the anatomical location and the size of excision. So the excised diameter is greatest lesion diameter plus the narrowest margin required for the complete excision. You can see here the lesion size is 0.0 centimeter, but margin are 0.0 centimeter this side and 0.1 centimeter this side and 0.1 centimeter this side. So altogether we have to calculate this as the 0.4 centimeters. So here you have to include all this lesion plus margins. So measurement is taken before excision. The excised diameter remains the same regardless of the type of wound repair, example linear closure or graft. So if it is multiple lesions, each malignant lesion excised must be coded separately. And the closure guidelines, simple closures included in the excision codes. For intermediate or complex closure is performed, report it separately using the intermediate closure code series or complex closure code series. For reconstructive closure such as grafts or flaps, you have to use the relevant codes for them. So we will discuss with when you come to the flaps or graft coding guidelines. So if the adjacent tissue transfer is done, report only the tissue transfer code. So do not code the excision code separately. For re-excision, that is when margins are inadequate, for additional excision is required during the same operative session, report one code based on the final widest excised diameter. If re-excision occurs at a later session, report the appropriate code again and append the modifier 58 as the staged procedure. So when you see the code series, the CPT code series ranges from 11,600 to 606, includes the trunk, arms and legs. Depending on the size, the code varies. Similarly, 11,620 to 26 for scalp, neck, hands, feet, genitalia. And 11,640 to 46 include face, ears, eyelids, nose, lips. So let's see some examples to understand this code series. Question number 19. A 65-year-old male undergoes the excision of a malignant melanoma from his upper arm. The excised diameter, including the necessary margins, measures 2.5 centimeter. Which CPT code is reported? So there are 4 codes available. Take your CPT code book and find the answer. So here you have to highlight this is excision of a malignant lesion, that is malignant melanoma on the upper arm. The size is 2.5 centimeter. When you look at the answer, all the adjacent codes, so you can use the elimination method in the exam, but for learning purpose, we'll use the table of contents or the alphabetic index method. So table of contents, you can go to the integumentary system table of contents. There you have to go to the skin, subcutaneous and excised structures, and excision, malignant lesion, this code series. Or else if you are going through the CPT alphabetic index, go to the main term excision, then go to the subterm skin, then go to the subterms lesion, that is malignant. So this code series you have to check. So when you go to the code series, 11,600 is excision, malignant lesion, including margins, trunk, arms or leg. So in our case, this is upper arm. So arm included in this code series. 0.5 centimeter or less. In our case, this is 2.5 centimeter. So 2.5 centimeter included here, 2.1 to 3 centimeter. So the correct code will be 11,603. Question number 20. A surgeon excises a 1 centimeter malignant lesion from the patient's lower lip and a separate 1.5 centimeter malignant lesion from the scalp during the same encounter. How should these services be reported? So there are 4 answers available. Take your CPT code book and find the answer. So here you have to highlight there are 2 lesions. One is 1 centimeter malignant lesion in the lip. Other one is 1.5 centimeter malignant lesion on the scalp. So when you look at the answer, you can all are adjacent codes available. So you can use the elimination method in the exam. But for the learning purpose, you can use the table of contents or the CPT alphabetic index. So once you go to the codes, you can see 11,640 is excision, malignant lesion including margins, face, ears, eyelids, nose, lips. So this code series, in our case, that is lower lip 1 centimeter. So 1 centimeter is included here. Excised diameter 0.6 to 1 centimeter. When you look at other codes, that is start from 1.1. So the correct code will be this one. 11,641 for the first lesion. So the second lesion, that is 1.5 centimeter malignant lesion on the scalp. So here 11,620 starts with excision, malignant lesion including margins, scalp, neck, hands, feet and genitalia. So here scalp is included. So our margin is 1.5 centimeter. So 1.5 centimeter included here. Excised diameter 1.1 to 2 centimeters. So that is 11,622. So correct 2 codes are 11,641 and 11,622. But here you have to add the modifier 59. So these procedures involve the different CPT code series. So the modifier 59, that is for distinct procedural service, is appended to indicate it was performed at the different anatomical site, that is lips versus scalp, and is independent of the primary service, thus qualifying for separate reimbursement. So this is the end of this part. If you have any questions, please leave in the comment section. If you have any issues, feel free to leave in the comment section, or else you can contact me using WhatsApp and email addresses. Please subscribe my channel and keep in touch. Thank you.